any changes, I'd say, over the past year.
I mean, I think obviously, the pandemic has been the biggest headline. What's been that impact on patient volumes and on practice's ability to treat patients due to social distancing and everything else. And I think what we're pretty quickly seeing is a return to pre-pandemic levels. And if anything, there's a narrative out there that, maybe there's a little bit of pent-up demand or the Zoom effect that's driving. So I think overall, the market appears to be very healthy. There were a few pockets that were a little slower to recover, New York City being one of those areas, the Bay Area, somewhere people sort of got out of town and that, impacted a little bit, but they're probably going to get treatment elsewhere, right? All of that seems to be rapidly returning to normal. So I think we're going to get back to the pre-pandemic growth drivers of younger people engaging in aesthetic treatments continuing to move from being a vanity play to a lifestyle play, more men getting treated, people living longer, wanting the best version. And with new entrants like us, more dollars get spent, and that helps awareness and sort of bringing people in that might be on the fence that come in. So overall, we're very encouraged with the overall sort of health of the market after having come through what was obviously a challenging point in time. And so I'd say that's the most notable thing. The rest of it, I think, is pretty much sort of as it's been, right? So that's probably the biggest change.
I've toured the facility in the past. I mean, I'm obviously just a finance guy. I'm not a FDA inspector, but it did seem to me when I toured it, years ago, that it was everything was very new. Everything was very state of the art. Can you maybe just describe the investments that your team, I know Abhay has probably put a lot of work into this as well, your team has done in kind of preparations for launch?
Yeah, well, I mean, as you point out, we've had to make significant investments at our Newark-based facility. We make both the drug substance and drug product there. And so in order to accomplish that or to accommodate that, we've had to make, investments in fermenter and water for injection and everything else. And since it was purpose-built for this indication, we feel very good about what we have put together. And as you mentioned, Abhay, I mean, he's had a long history at Allergan, sort of building out some of their manufacturing facilities on the toxin side. So we feel like we've got the right people that understand how to manufacture and produce this product. So we feel about as good as we can coming into the overall site audit. We've disclosed also previously that, we've got a contract relationship with AJI down in San Diego. So, our facility is not geared to be high throughput manufacturing. We're certainly going to build drug product there, but we will use a third-party contract manufacturer once we get this approval through the BLA supplement process to expand our capacity. So, it is a single manufacturing facility. That's what will be inspected. And so, again, we feel about as good as we can.
And how about the commercial footprint? I know Dustin's not on the call, but I would love to know kind of how you've taken this time to prepare commercially.
Yeah, well, I mean, thinking that we were going to get approved in November of last year, we already had spent a fair bit of time in terms of what's our positioning, our pricing strategy, all the materials to support that launch. So we've had even more time now to sort of refine and tweak those, particularly with the benefit of the RHA filler launch and some of those relationships. We're roughly at around 100 reps right now. We think that's the right size. And as we've communicated to, the street, the launch of our neuromodulator, once approved, first quarter is going to largely be in the hands of a small select group of physicians to give us feedback because the product's only been used in clinical trials. And we do know that in real practice, physicians tend to tinker a little bit, right? In terms of dosing and dilution and all these things. And then the second quarter of launch, we'll put it into sort of the hands of our preview group of customers, 100 or so, that will take that sort of collective learning and we'll do that again. And the reason we're going to do that is we feel really good about, if you look at the clinical trial performance and the duration profile of the product, we just need to make sure that we build a really solid foundation because we know there's going to be no shortage of accounts that want the product. So we got to make sure that by the time it gets there that we understand. So because of that, the 100 reps that we have right now selling the filler line aren't going to have a huge sort of sales push in these first two quarters, given sort of the preview launch and the way that we're going to go, which then will take us to probably the beginning of the year where we'll look at, okay, do we want to add some more reps? We probably will call it another 30 or so reps. That's the right time to kind of rethink about territory geographies and how do you want to set quotas and cut things. So, that's kind of how we're thinking about it. And obviously the approval timing will sort of push things a little bit on that, but that's sort of how we're thinking. But we believe we've got, the launch strategy in the bag. We're ready to go with it. And we think we've got sort of the right team and people largely in place right now.
And I've heard anecdotally that, some practices in Southern California are already hearing kind of inbound requests for the 6-month neuromodulator.
Right.
So it's interesting to hear that there is some sort of at least, awareness in the community. Can you talk maybe about the satisfaction that patients saw in the clinical studies and maybe some of the open label results?
Yeah. So, in the Sakura program that we did, we had, sort of very high patient satisfaction. And we also know from our market research that, duration is sort of the number one kind of unmet need that consumers want. So, and in talking to the physicians, I think we got a really good sense in terms of just the overall happiness on their side, because they have a better sense for looking across patients, right? Not just an N of one. Good skin quality, really good, happy patients. And so we come into this market with, I think, a lot of goodwill attached to it where, hey, this is a really great product, had a great experience. Patients were really happy. And as you pointed out, given that we aren't approved yet, we haven't been able to do any promotion on the product. I think that in today's environment with social media and certainly aesthetic consumers being very up to date on what's the latest, I expect that without a huge investment on our side, this is the type of thing that's going to get a lot of play in the market around sort of the long-acting neuromodulator. And so, we believe that the table is set the right way. We just need to make sure that, again, they get the outcome that they want and that we train these injectors the right way on the front end.
And I know probably every meeting you've had since you've become CEO for Vance, there's always this question about pricing. Can you just maybe address, give us your latest thoughts on pricing? And if you'd like to announce pricing, feel free
That's
to.
right,
Well,
exactly.
but,
right.
Just your latest thoughts would be appreciated.
Yeah, I mean, I think nothing's really changed, and it's probably for competitive reasons. We certainly know the pricing that we're going to put out in the market. But, if you think about it, a product that lasts twice as long, you could theoretically charge twice as much for it, and maybe even more because of the convenience factor. We think that that's probably pushing the outer bounds of this whole thing. But there's a number of people that you have to think about. It's what does the consumer pay, what does the physician pay, and what ultimately can we charge? We believe that since we've invested hundreds of millions of dollars to bring sort of the first meaningful innovation in neuromodulators in over 30 years, that we should get rewarded for it. And because of this sort of longer duration profile that we're seeing, not just in our aesthetic trials, but in our therapeutic trials as well, that we should get a premium to existing neuromodulator products. In talking to physicians, they're willing to pay a premium as well, particularly if they think that there's an opportunity for them to make more margin. So we're going to price it in a way where physicians can buy it, pay a premium, but turn around and charge the consumers more for that. And again, we're looking to create segmentation in the market. This isn't a one size fits all. So for some consumers that say, I don't want to pay more, I want to come in every 3 months to get my treatment, great, then this is not the product for you, which is fine. For those that, hey, I normally only come in 2 times a year, I like the idea of a longer duration, I'm willing to pay more, physician makes more margin, we think that that's going to resonate with a large group. So, we'll make more, physicians will charge more, consumers will pay more, but all that rolled up is probably not going to equal more than 2x and is likely going to be below. And the reason I say likely is we're not going to mandate consumer pricing, right? For some physicians, they might choose to compress that margin. For others, they might say, hey, with new technology, this is my shot to more meaningfully enhance my margin. And as part of our overall prestige strategy, even with like our fillers, we don't allow for the advertising of price. We think that whole push of doing Groupons and advertising aesthetic injectable pricing is commoditizing the business. And so we're saying you can't advertise. That should be a discussion between the patient and the physician. And that can take place on here's one option, here's another option. And so they're ultimately going to determine what they feel that fair price is.
Okay. And maybe that's a good time to talk about the fillers a bit. The filler market is incredibly robust and
Right.